Please subscribe Mumtaa for daily updates on your exciting pregnancy journey and comment for any query. Pregnancy and the birth of a baby are two of the most miraculous events in a woman's life. It is a time of excitement, joy, and anticipation, but it can also be a time of uncertainty and anxiety. In this video, we will discuss the stages of pregnancy and what to expect during each stage. We will also talk about the different types of birth and what happens in each type of birth. Stages of pregnancy. Pregnancy is typically divided into 3 stages or trimesters, each lasting approximately 3 months. Let's take a closer look at each stage. First trimester, weeks 1 to 12. The first trimester is the period from the first day of your last menstrual cycle to the end of week 12. During this stage, your baby's organs and body structures are developing rapidly. You may experience symptoms such as nausea, fatigue, and breast tenderness. It is important to begin taking prenatal vitamins and to eat a healthy diet. Second trimester, weeks 13 to 28. The second trimester is the period from week 13 to week 28. During this stage, your baby's body continues to grow and develop. You may start to feel your baby move around week 20. You may also experience some relief from the symptoms of the first trimester. It is important to continue taking prenatal vitamins and to stay active. Third trimester, weeks 29 to 40. The third trimester is the period from week 29 until birth. During this stage, your baby is growing rapidly and putting on weight. You may experience symptoms such as heartburn, back pain, and difficulty sleeping. It is important to attend all scheduled prenatal appointments and to prepare for labor and delivery. Types of birth. There are 3 main types of birth: vaginal birth, cesarean birth, and assisted vaginal birth. Let's take a closer look at each type. Vaginal birth. Vaginal birth is the most common type of birth. It occurs when the baby is delivered through the mother's vagina. The mother may push the baby out on her own or with the assistance of a healthcare provider. Vaginal birth is usually the safest and healthiest option for both the mother and the baby. Cesarean birth. Cesarean birth, also known as a C-section, is a surgical procedure in which the baby is delivered through an incision in the mother's abdomen and uterus. Cesarean birth may be necessary if there are complications during pregnancy or labor, such as fetal distress or a breech position. Recovery from a cesarean birth typically takes longer than recovery from a vaginal birth. Assisted vaginal birth. Assisted vaginal birth is a type of birth in which the baby is delivered through the mother's vagina with the assistance of a healthcare provider. This may include the use of forceps or a vacuum. Assisted vaginal birth may be necessary if the mother is unable to push the baby out on her own. After birth. After the baby is born, the mother may experience a range of emotions, from joy and excitement to fear and anxiety. It is important to take care of both the mother and the baby during this time. The mother should rest as much as possible and eat a healthy diet. The baby should be breastfed or bottle-fed on demand. In conclusion, pregnancy and the birth of a baby are exciting and life-changing events. It is important to take care of yourself during pregnancy and to prepare for labor and delivery. Remember to attend all scheduled prenatal appointments and to discuss any concerns with your healthcare provider. After the baby is born, take time to rest and enjoy this special time with your new family member. Thank you for watching the video. Please subscribe channel for daily updates.